Welcome to the Aging Well podcast, where we explore the science, stories, and strategies behind living a longer, healthier, and more purposeful life. In this episode, I am joined by filmmaker Neil Steinberg, director of a powerful new PBS documentary, Aging in America, Survive or Thrive. Backed by the John A. Hartford Foundation and premiering May 1st, the film takes a hard look at the structural, economic, and ethical challenges of aging in the United States. From homelessness and economic insecurity to flaws in our nursing home system, Aging in America asks an urgent question. As our population grows older, will we choose to merely help people survive or create a society where they can truly thrive? Neil brings more than 4 decades of experience in the aging space, including a longtime connection to Dr. Robert Butler, the pioneering gerontologist who coined the term ageism, and whose groundbreaking book, Why Survive? Being Old in America, inspired the documentary. We discuss Dr. Butler's legacy, the stories behind making the film, and what real solutions might look like for the future of aging policy in America. Stay tuned as we explore how compassionate care, smarter policy, and a new vision of longevity might shape the path forward, and what it truly means to age well in America. Neil, welcome to the Aging Well podcast. If you would, just tell us a little bit about yourself and what inspired you to create Aging in America, Survive or Thrive.
So I've been working in the film and television field for my entire career, and I've done fiction and nonfiction and sports and documentaries and kind of been across the board. What inspired this particular project actually goes back to early in my career. When I was like 30 years old, I had the great opportunity to work on a project called Caring for an Aging Society, and it was a 20-part video series. And one of the people involved was a gentleman by the name of Dr. Robert Butler, who was truly a pioneer in the field of aging. And he hosted the series along with Ken Dykewald, who was also the executive producer of it. Dr. Butler was quite legendary. And he wrote a book back in 1975 called Why Survive? Being Old in America. And that book won the Pulitzer Prize. So we did that. I did that thing. I was in my 30s. It was great. Then many decades later, I bumped into a woman. I was working again with Ken Dykewald, but bumped into a woman, Terry Fulmer, who was also involved in that project. And Terry is now the president of the John A. Hartford Foundation, which is a foundation, wonderful people that are dedicated to helping the lives of older adults. And she and I started talking about doing a documentary together for PBS. And she said, Dr. Butler, who passed away about a dozen years ago, his legacy has never been honored the way it should. So let's do a documentary to honor Dr. Butler's legacy. And what evolved was we took his book, Why Survive, which was this landmark in the area of gerontology and geriatrics. And let's look 50 years later, how are we doing, based on what he said we needed to do? And how far have we come and how far do we still have to go? So that was kind of the impetus for this documentary.
The documentary tackles some pretty difficult truths about the aging infrastructure in the United States. What do you think are the most urgent policy issues that we face right now?
I think one of the themes that came up a lot in the filming of this, and I'm not a geriatrician or a gerontologist or an expert in anything. What I do is kind of make movies. And so but in listening to people who are experts and have traveling the country, talking to the best minds in the field, a couple of themes emerge. One big theme is that as a society, we spend a lot of money to take care of older people in terms of healthcare and all that stuff, and in other social services. But the universal consensus was we spend it in the wrong places. Our society is really big on spending money to fix problems. We don't spend money to prevent problems, and which could be way more cost effective, not only financially, but from a human standpoint, obviously. So that was kind of one of the big themes that came across. Another big theme that I learned was Dr. Butler coined a word back in 1965, ageism. Never existed before, and he was the one who kind of first used that word and popularized it. And one of the things we looked at is, does ageism still live, in our modern world, or are we past that? And the answer was clearly we're better than we were back in 1975, but there are still remnants of it. There are still, in certain industries and certain attitudes, ageism still does exist. And in our documentary, we would show like commercials that were ageist, that were, you know, either making fun of older people and kind of showing them in a goofy way, or the incredible pressure to, you know, not have wrinkles and not look like you're old. And that whole industry that kind of says young is good, old is bad, you know, that still permeates our society. So those were a couple of the areas that we wanted to address. Other topics that we address in our documentary include long-term care in nursing homes. That's kind of a very volatile area right now, where part of it is that COVID kind of exposed. Those aren't the best run places and stuff like that. And we kind of get into how ownership affects the quality of care in a nursing home, and that most importantly, what are the options for nursing homes? They're financially not feasible with an aging population. You know, there's just so many more of us that we really have to rethink the system.
Yeah, I think I just heard recently that, is it this year that half of the population in the US will be over 65?
I
I think this was a year that we hit that or something.
There was a year that we hit that. I don't know when that. I think that's a ways away. I think
Yeah.
this year was, if I'm not mistaken, and this is the year that more people are over the age of 65 than under 18.
Okay, maybe that's what I heard.
Yeah, and I think, and I would double check those facts before you
Yeah.
did that.
Somewhere in there, there's there's a lot of us old folks in the country right now.
And what's really interesting about that is, and that's one of the things that I've kind of working in the aging field from the filmmaking point of view, telling the story, is that this is a brand new story. Throughout history, there were old people, but very few of them. And so now we've got a whole, you know, generation, a whole society here of people that have a lot of people north of 60 or 65 or 85. And that we've never had that before. And it provides a lot of opportunities and challenges. I mean, it's great that you can, you know, experience your grandchildren or great-grandchildren or great-great-grandchildren, and how much wisdom can you gather over that many years. It's really something to be celebrated. But at the same time, there's burdens on it. I mean, it's if you're not in good health and you don't have financial security, those later years can be really challenging and difficult.
So was there any particular story or interview in the film that left the most lasting impact on you personally?
There was a couple. One particularly was, we visited a couple in Wyoming, Brenda and Michael, who were in their mid-60s. And Michael suffers from Alzheimer's, and Brenda is his caregiver. And they live out in the middle of, I would say in the middle of nowhere. That's a city guy talking. But they live in a very rural area. And she gets up early and, you know, takes care of the farm or the ranch, and there's animals, and she works a part-time job, and she takes care of her husband. And Brenda was one of those really solid, spine of steel, kind of just really salt of the earth kind of people. And she was just so impressive. And in talking to her, I realized, and this applied to another person I'll tell you about in a second thing. When we think of people who need help, we think of people sometimes who are helpless. This is a really strong, powerful woman who needed a little help. And society's kind of step up and help these people. The other one I was thinking of, which applies the same thing, was that this woman, Connie, who lived in San Diego and had a difficult childhood, but she was became a nurse, had savings, everything was going okay. And then, you know, she's getting older and she gets cancer, and it wipes her out, not only physically and emotionally, but financially. And she ends up homeless for 11 months until, a group helped her get some affordable housing. But again, this woman had the strength and resilience I could only dream about having. And these people sometimes need help. And I think society's got to really, one of the takeaways for me from this was that you really kind of have to step up to the plate, that a lot of people in the country, especially as we live longer and grow older, you know, become a little bit vulnerable. And we have to make sure that there are systems and nets in place to help these people.
And that kind of leads to my next question, which in the title, it really poses a powerful question. So what does it mean to thrive versus merely survive as we age?
Well, as I mentioned, we do some profiles. We did a profile of this gentleman who was a banker all his, you know, stressful job. But when he retired in his 60s, he became head of a non-for-profit. And he realized that this was the best time of his life. He felt more satisfied. His relationships were better. The work meant something to him that it never did in his career before. So there's this new chapter, this third chapter in life that could be really exciting about, you can pursue a passion, you can have a purpose that never existed before. And, talking to people, it's kind of a rebirth almost of what can happen in your later life. And that's at the positive end of the spectrum. The survive is, more the people who sometimes because of, the way they had their life, ran their life. But I think a lot of times by the cards that life dealt you. I think one of the takeaways for me for this was that, you know, it's important to save and take care of your health as you grow older and, to take full responsibility for your own well-being. But at the same time, there are moments where life throws you a curveball and it's not your fault and you might need a little help.
Yeah, I think that's really where our society is at right now, where we have to learn to take a little bit more personal responsibility so that we can care better for the people that do their best, but then just stuff happens in their life. And
Yeah.
we have several different phrases that come up a lot on this particular podcast. We have people talk about the third act. We've had conscious aging has come up a lot, and we tend to favor talking about aging with the four stages of life. You have the first stage, or the first age is when you are dependent. You're dependent upon your parents. The high school to college age,
Right.
and then your second age being the age when you are developing your careers, you're having families, and you're building up your finances. And then the third age is really that most important aspect of life where we're into retirement. We hopefully are financially stable, we're healthy and doing all that. And then the fourth age being that age of decrepitude and decline, which is what we want to avoid as much as possible. But like what you're talking about, we want to be able to care as best as possible for the people that get into that age and keep it as short as possible, keep it as healthy as possible. And so you met Dr. Butler in, what'd you say, was it 1986?
Yeah.
While you
86.
were
Right.
working, and
Yeah.
you were working on the Caring for the Aging Society.
Yeah.
What was it like collaborating with him, and what do you think he would say about the current state of aging in America?
Great question. It was a pleasure and an honor to work with him. When he walked into a room or something, there's certain people that just give off this vibe of they kind of glow a little bit and they're special and the phrase they suck the oxygen out of the room. He had that kind of quality. And he also was really incredibly perceptive. And I was obviously very impressionable at 30. The idea of aging was kind of not really high on my radar. And an example of what kind of made him special for me was a story we were filming inside a retirement community. And it was one of those big, sprawling retirement communities that are pretty, well appointed and pretty terrific. I mean, they had like their own TV station and their own, theater group. And it was one of those villages. And they had this large room that was a carpentry shop with power tools and stuff. And he and I kind of walked in there and I'm thinking, well, as a filmmaker, oh my God, this place is great. It couldn't be more visual. And here are these 80-year-old guys over, saws, and they're making furniture. And you could really tell that these were like master craftsmen. And it was like, oh my, this is so great. And I turned to him, I said, God, isn't this wonderful? Look at how great it is. These guys still get to do what they do. And he said, yes, but it also makes me sad. And I said, why? And he said, there should be a teenager standing next to each one of them soaking this in. And it kind of took me up and I went, yeah, you're right. And because it's that will die off with them. And the ability to not only see what is, but to see what should be is such an amazing quality. And I think he kind of had that in spades, that ability to look at things and go, it should be this. It is this now. And it's not just poking at what is, but visualizing what it should be. And I think that was a great gift he had in my
So
limited exposure to it.
how do you see or think ageism kind of manifests itself today in public policy? And do you have any ideas of what we can do to kind of dismantle it?
I think overall, generally in society, there is a sense of young, hot, that's the future. That's, it's all true. And I'm not negating that. But I think one of the things that I've learned, working in the aging space for a while, is that the vitality and the, let me rephrase that, vitality, the enthusiasm of youth sometimes, and the knowledge of technology can't replace experience and wisdom. And it's, I think they're complementary. And I think we're strongest when we work, across generations and across ages. And if you were having a team, if you have a team with from different age groups, you're getting the best of all possible worlds. And I think it's just those kind of diverse points of view where we can, and now that I've just turned 70, so I'm kind of, I appreciate what I can learn from younger people, but I also appreciate what I have to offer in finding those combinations. I think society doesn't kind of work that way. I think people right now they want to stick with their own. And I think we have to break that down a little bit and really respect the power of being intergenerational.
So, are there any other changes, whether it's policy driven, cultural, or community based, that you believe will make the biggest difference in improving the aging experience in America?
Well, I wish I had the answer to that. And I'm being perfectly honest. I don't know what single policy thing. I mean, right now, because of the volatility in Washington and all the changes going on, it's hard to imagine, what it would look like on the other side. Things are changing, and I don't know exactly. There are people who've been studying this stuff and who can tell you if this bill passes, it'll be important. I do know that protecting Medicare, protecting Medicaid, protecting Social Security is critical. I mean, when we were traveling around, there are people who they live on that, and that gets them through the day. And if there was any disruption to that, it could be catastrophic for millions, if not tens of millions. So I know protecting those kind of nets that we have, but I wouldn't venture what new policies we should be making, just because that's not mine.
I can see, really a need to explore what we can do culturally and in our communities to kind of combat ageism and just provide communities that are going to be more accessible to our aging population. Because not everybody's going to be able to move to Florida and go into those retirement communities and do all that. And, the whole idea of some of like continuing care retirement communities are great, but they're expensive.
Well,
And
yeah, one of the things that came up also on when we were filming was that people want to stay in their own homes as long as possible, and that could be facilitated, and that could be cheaper than a nursing home. But the way our reimbursement structure works, it doesn't pay for that. So that goes back to the idea we're discussing what pays for what we pay for is sometimes not the most efficient thing. And I agree with you completely. A lot of this work has to be done on a local level. That woman, Connie, who was homeless, what saved her was a local not-for-profit that's very well established in the community, and they understand their community and they're helping people. You've been around this for a while. I mean, what national policies do you think would really best serve older adults?
I think personally, I would look more at local policy than national, because
Okay.
I don't trust our national governments to do things to really take care of my neighbor. They're going to look at the things that are going to most profit pharmaceutical companies, public hospitals, or rather private hospitals, and where people are going to be able to make money off of this rather than looking at what's going to be. And maybe I'm a very, I don't know, cynical person when it comes to how our government treats the overall population. But I really think it's going to come down to much more local community action. And maybe what the federal government could do would be to really better support states and local communities that are trying to improve the quality of life for our aging population. And I think building our communities, we should be putting the front porches back on, because I grew up in the town, in suburb of Pittsburgh that, we had close-knit communities, houses were really closely built, and everything had a front porch. And I remember as a kid, I mean, I knew all my friends' grandmothers because they either lived in the neighborhood or, they lived with the families. And we don't see that anymore. And so I think it's going to come down to what do we do as individuals. And I teach my students, I have a pathophysiology and exercise class. And one of the assignments I have them do is to read The Tragedy of the Commons. I don't know if you've ever come across that. It was written by Garrett Hardin back in, I think, 1968. And I have them read that and consider how that applies to our present healthcare system. And, we promote it. I live in Oregon. We just a couple of years ago passed a change in our Constitution that universal health care is a human right.
Right.
And to me, it's like, okay, you can say that, but it's not sustainable. The only thing that's going to be sustainable is to consider that, universal health is a human right.
Right.
And until we really look at everybody has a right to be healthy and what do we do to get those people healthy, I don't think we're going to accomplish anything because we're just going to have to keep spending more and more money. I mean, we can say, okay, the government should fund, nursing care facilities, which is great. And they should. But until they start doing things that are going to make our aging population healthier, give them access to things that are going to limit diabetes, change food access, looking at where are we building fast food restaurants, but not building, grocery stores.
Yeah.
We don't have public transportation the way we used to, where families can get around and, older people can get to the grocery store and get the foods that they need. And, so I really think it's going to come down to a much more localized, individual action as opposed to expecting the federal government to do anything.
One of the things we do in our documentary is look at what some innovative solutions could look like. Well, what's the cutting edge? And for example, we spent some time in San Francisco, and they do two things that we found really interesting and really kind of out of the box thinking a little bit. And that was one, they have what's called at San Francisco UCSF hospital. They have what's called an age-friendly emergency room. And the idea is that if you're an older adult and you go to the emergency room, it's really easy to get lost in the shuffle. And that their thinking is that if you break your arm at 17, it's very different than breaking your arm at 84. And you have different problems and different needs. So when they kind of direct you over to the age-friendly emergency room, it's staffed with geriatricians who understand, the comorbidities, and possible cognitive issues, and all the things that, older adults cope with. So that was such an interesting and obvious thing of like, you know what, let's get those people to the right people. Another one that they had, which I thought was great, was we spent a day with a woman who's a geriatrician, and she did house calls from the hospital. And we went, and she went to the homes, and we spent some time with her in the filming a 94-year-old woman who had diabetes, and she had a leg amputated. It was very difficult for her to get around. But having this physician come to her house was just ideal. It was great. It really was efficient. And I was interviewing the woman who ran that, and I said, it obviously is great, but how do you afford that? I mean, how many can she do in a day? And she said, maybe 8 house calls in a day. And I go, for a physician, how do you pay for, that doesn't seem to make dollars and cents. And she said, we did some studies and we realized we can do 10 house calls for the price of one emergency room visit.
Wow.
And you get a lot more done with 10 house calls. And it's just that kind of, let's think about things in a different way. Let's kind of take a step back and say, okay, is there a better, smarter, more effective way to do this? And I think, it's sometimes we get obsessed with how much money are we spending as opposed to what are we spending it on? And I think that's one of the lessons that I took away from this is a lot of thought needs to go into how to spend whatever money you're spending in the most effective way.
Yeah, I think we're in our healthcare system in this country, we're much more of the mentality of treating symptoms and managing the costs of doing that as opposed to looking at, rather than spending trillions of dollars on treating, diseases like diabetes and obesity related diseases and, inactivity related diseases, let's spend some money on making it possible for people to have access to healthy foods, have access to preventative care, to exercise, and all these things. It's so much cheaper, but no, we're going to just spend trillions.
Not only cheaper, but from a humanitarian point of view, it's so much. We have some video of Dr. Butler, that we collected, that he was on television many times over the years. And in one soundbite we have of him in our healthcare section, he says, frankly, doctors don't make money The doctors only make money when you're sick. Hospitals only make money when you're sick. There's no incentive, financial incentive, to keep you healthy. And he said that 50 years ago, and it's 40 some years ago. And it's like, we really haven't learned a whole lot. That's where we've fallen short. We still suffer from that situation.
I think one thing that's come up in some previous episodes that we've had is how we could benefit from, building more of these senior communities in conjunction with universities, as well as even like primary schools, where young kids could benefit from the experience of the older adults and give them something to do. But also these college kids that are maybe studying to become physicians or physician assistants or physical therapy, occupational therapy, all these different fields can be working with this aging population, providing care for them, learning in the process, and just that overall interactions. Like you said, when Dr. Butler noticed that these woodworkers should have teenagers next to them learning, we're just missing out a tremendous opportunity to bring our generations together to benefit from everything that each generation can give the other.
I heard a story on that, and I hadn't seen it firsthand, but I heard a story from a friend of mine who works in the field of there was a nursing home, and what they did was it was next to a music school, college, and they allowed several of the students there to live in their nursing homes for free. It was free housing, but they did concerts like twice a week, and it was like such a win-win for everyone.
Yeah.
And the great tag to that story was that one of the music students got married, and her maid of honor turned out to be this 87-year-old woman from the nursing home that she got so close with. And I think that idea of intergenerational is so critical. One thing that came out in the documentary, which was interesting to me, was, and this was from a gentleman named Fernando Torres Gil, talked a lot about this, was we don't think in terms so much of older people but think of aging as a lifelong process. And how do we kind of age well all the time? And instead of dividing ourselves up into groups, that look at it much more as a continuum of, aging is something we do our whole lives. And so I thought that was a really interesting way. And that a lot of people are using, instead of the word aging, it's much more, I found really common or popular to use the word inaccurate, longevity.
Mm-hmm.
Because longevity is something people are comfortable with. Oh, yes, everyone wants longevity, but because of the stuff we put around the word aging, it kind of brings you down. Where longevity is much more optimistic.
Yeah, and I see, the path that we've taken in using longevity. It's all about adding years. I mean, you have two perspectives in there. You have the adding years, which we have done very well in our healthcare system, getting people to live longer, but not living well longer.
Yeah.
And, from a health span, I think is one of those areas I think we need to focus a little bit more on is how do we extend the health span of individuals? But we also talk on this podcast a lot about how aging well really begins at conception. And everything that's going throughout our lives is leading us to where are we going to be as we get, more and more years on the calendar. And if we don't start off well, it's going to be a lot harder to end well. And, you don't get the better finances, you don't have the better health. I mean, there's so many different things. And so it is a continuum. And I think the language is going to be one of the biggest challenges for us is what's the best language to use? Because there's too many people on YouTube now that are longevity experts that,
yes.
It's take this particular supplement and do all this kind of stuff. And it's like, no, you got to understand that from my perspective, it's biomechanical psychosocial. It's
so, Dr. Armstrong, you've been talking to some of the, leaders in this field, obviously, of course, you're doing this podcast. So clearly taking better care of yourself physically, and we know what exercise and diet and all those things can be. And financial resources, clearly it's important to have enough to live comfortably. What other elements have you seen successful aging or, growing older in a real positive way? Besides health and finances, what are the other factors that you found really contribute to a positive later?
Yeah, it's interesting. I mentioned I teach in pathophysiology and exercise class. And after teaching that for a number of years, I was always promoting to my students, there's really four things that you need to do to be healthy and have longevity. And that's physical activity and exercise, maintain a healthy body composition, eat a healthy diet, and don't smoke. And since doing this podcast, we've added really two more to our what we call our pillars. And one is sleep hygiene. And I think that's one thing we really need to focus a little bit more on. We'll prescribe for people sleep aids that many of these sleep aids that people are taking are leading to dementia, or they are linked to dementia. They don't help you sleep effectively. You're basically just asleep longer. So sleep hygiene has become one of them. And then the biggest one that I think surprises me that I've added it and have grown to emphasize so much more is purposeful social connection. Not only just social connection, because I think it's easy to say, well, just get involved in this club or that club, or, hang out with more people. But there's a lot of opportunities to socialize that are not beneficial or healthy for us. But if we look at those purposeful ones, the people that are going to help us to grow, to maintain our vitality, talking about having interactions with teenagers, younger children, college age kids, all of that is, I think, hugely important to aging well. And so I'm slowly starting to see that social connection piece elevate itself. And I shouldn't say this as an exercise physiologist, but starting to see that elevate itself a little bit higher than the exercise piece.
When you said positive social interactions versus not positive social, what's the line? What's the distinction between the two? Fascinating.
Well, I said purposeful. So positive and purposeful, leads to the positive versus negative. But positive is, I think in terms of what's going to help us grow. And it's a chance to plug my friend Jay, who took my well-centered fitness and recognized that I always say it in the same way that it uses the acronym SPIES. So we just simply have shortened it to SPIES now, which is the spiritual, physical, intellectual, emotional, and social. And so I would look at purposeful, positive being the things that help us to grow in those ways, as opposed to spiritually growing us outward, where we're more other-centered, as opposed to growing us more inward, where we're more self-centered, physical, all that goes with that, maintaining healthy muscle mass, maintaining healthy body composition, eating a healthy diet that's going to allow us to function as well as possible, hormonally, psychologically, neurologically, be able to digest and absorb the foods that we're eating, getting an intellectual, where we're continuing to stimulate the brain and to learn, to grow, and to share our knowledge as we're aging. And then emotional is just, depression is such a crisis level in our country. I mean, it's pandemic, especially in the aging population. There's more and more loneliness. And if we don't keep that connection with other people, you start to lose friends as you age. And what are you replacing those with? And if you have younger companionship, younger relationships, you're almost always kind of turning over those relationships. Yes, you're losing friends and you're losing family, but you're also tending to gain from those younger populations. And that kind of leads then into, just social connections in general, but those social connections being what really feed us spiritually, physically, intellectually, and emotionally.
No, it's interesting because there's the work you're doing, in terms of helping yourself to grow older better. What we were trying to do with this film is find something completely different, which is kind of looking at it from a societal point of view. The idea of what is us, instead of what did I do to make old age better, it's what do we do as a society. And it was an interesting exercise or perspective to kind of go exploring what do we as a society do. And it's very much tied to what we were just saying, but it's an interesting other layer to it.
Yeah, and I don't think we can do the what can I do better if we don't address what can we do as a community. Because it's easy to sit here and say, if you want to age well, exercise, eat right, maintain a healthy body composition, don't smoke, and do all these things that I just talked about, but we don't provide you access to healthy physical activity and exercise. We don't give access to healthy foods. One of the things that drives me insane is when we look at providing food assistance to people. what do? We give them food stamps or, cards that they can use, or they go to food pantries where people have dumped off their rejected canned goods. And I've commented to people before, I always get frustrated when I see these news programs where they're talking about these people helping out people and providing food, and you see the food they're providing for them. Right on top, there's always like a loaf of white bread. And, some of the worst foods that we can eat, we're giving to the poor rather than giving them access to the healthiest types of foods. And so it is as much personal responsibility, but it's much more of a social responsibility to give people the access to be able to be socially responsible. Because I think probably the majority of our aging population and our unhealthy population are not people that are stubborn saying, screw you, I'm going to do what I want, I'm going to eat what I want, and the healthcare system is going to take care of me. I think it's a lot more people want to be healthy, they want to age well, but they just, in their best efforts, really don't have access to it. And so I think it is that two-way, it's a kind of a two-sided coin. We have a personal responsibility, but we have a societal responsibility, and we can't ignore one or the other. So have you encountered in your kind of research and in the documentary any countries or models of care? I know you mentioned San Diego and a couple other cities in the United States, but where you believe that the U.S. can learn from those examples?
This current documentary, it was just kind of the American story. I mean, we traveled a lot, but within the United States. It's interesting you should mention that, though, because one project I actually worked on with Dr. Butler, we developed it, and it just never came to fruition. But after that first experience when we worked together back in the 1980s, really liked working. And he said, I want to do a documentary series about how it's different to age in different countries. And he even had a title for it. And he said, we'll call it The Graying of Nations. And I thought, oh my God, this is great. And we spent a lot of time developing it and stuff like that. This was, back then, but it never took off as a lot of projects never happened. But Dr. Butler started the International Longevity Society, that was in New York. And so he was very concerned with the international aspects of aging and what we can learn from other places. But for this Why Survive, that book was an American story, and we kind of kept it within our borders.
Yeah, it's kind of interesting that, when you look at the blue zones, which
Yes.
has been gaining popularity lately, we really only have one in the United States that's classified as a blue zone. And I feel like a country as wealthy and as expansive as the U.S., we should be setting the standard for what other countries are doing. You talk about what's the healthiest diet. Well, the Mediterranean diet is considered the healthiest for heart. Nordic diet is starting to kind of gain some popularity, and they're both pretty similar. But you're not going to hear anybody say the American diet is the longevity diet. And, so I think we have a lot to change here to become more the global standard for care of our aging population. I don't know if this little podcast of mine is going to change anything, but
everything helps. I mean, I'm working in media. How many minds do you change? Well, as many as you can. I mean, that's right. Just all you do.
And really, if you change one, if this documentary changes one person's mindset, that can have an impact on the community. That's going to have a ripple effect that, we just can't imagine.
So. And it's my goal is the guy who directed this. If somebody says, gee, I never thought about something that way before, that to me is the success. It's just to get people to think about things in a slightly new or different way. Or that's a little bit of information I didn't have.
Yeah. So what were some of the challenges or surprises that you encountered during the making of the documentary?
One interesting surprise was we were doing this profile of this woman named Brenda, who was a caregiver who was out in Wyoming. And her husband, Michael, suffers from Alzheimer's. And so we flew out to Cheyenne and we drove out to her place with a woman Amy Shaw, who is a dementia care specialist who was helping them. But anyway, we did a really long interview with Brenda, walked around her place, looked at her animals, and she was amazing. She's a real salt of the earth, terrific lady, and inspiring. And we're packing up our gear and we're ready to go. And she said, can I ask you a favor? And I said, sure. And she said, would you interview my husband, Michael? And I was trying to be sensitive to the fact that he had Alzheimer's and I didn't want to put him in an uncomfortable position. And I said, well, of course we would, but, I thought you said before that you kind of didn't want us to do that. And she said, oh, no, good days, bad days. Today turned out to be a good day. And he really wants to do it. And she said, you don't even have to use the foot. Just please do the interview with him and make him happy. And I said, well, I haven't prepared any questions, but sure, we'll sit down and do it. And I ended up speaking with Michael for over an hour. And it's clearly, I think, among the most poignant moments in the film where he was at a level of, he knew he was slipping and he was starting to, but you would see the slide and you'd see the recognition of the slide at the same time. And it was really moving to see somebody coping with all. And between the two of them talking about the situation, that was a surprise. And when you go out and you make a film, some things you think, oh, this is going to be great, and it just doesn't pan out. Other things, that shoot in Wyoming turned out way more powerful than I had ever hoped.
And I'm looking forward to the people watching and listening to this podcast kind of tuning out from my podcast for a little bit to tune into PBS and actually watch this episode, because I think it'll be really rewarding, and it should have a significant impact on our society. So I'm looking forward to
it. I appreciate that thought. So it'll be on PBS after May 1st. Different stations will have different day and times, but there is a Aging in America Survivor Thrive, all one word, website.com website.
Okay.
And that's one of the places you can get the information about where to view it.
Yeah, we'll be sure to link that to in the description notes so that people can kind of keep on top of it, because as I understand, it's going to be released more gradually across the country. So it might not be May 1st that it's going to be airing in your local PBS station, but if you pay attention, you can find it and get to watch it. So I'm going to ask you a question that we ask of all of our guests on the podcast, and nobody gets to escape it. I even had a young lady from University of Michigan. It's a pre-med student that is the ambassador for Care Yaya, which is actually a really interesting program where they connect college students, particularly those that are going into fields like medicine, nursing, and so on, with families that are in kind of that sandwich generation where they have younger kids, but also might have older parents or grandparents that kind of take care of. And so they provide care for these older adults. And just her experience, it was really cool. But she was my youngest, so I asked her, I think she's like, was she like maybe 20, 21? But I'm going to ask you, what are you doing personally to age well?
My first thing that popped into my mind, I'm not sure it's the most important, but I do a lot of puzzles, and I do, Wordle and Sudoku, and I'm kind of addicted to the New York Times puzzle stuff. And I literally do that on a daily basis. And I find it fun, but I think it's probably also pretty good for me. And the biggest thing I try to do is stay curious, constantly finding things to wonder about and joy out there. And gee, how does that work? And why are they doing this? And what a great experience that could be. Trying to keep my sense of curiosity and wonder, looking forward.
Well, it kind of comes with the job of being a documentary, right?
Yes, very much. Yeah. I'm not sure which.
I kind of feel the same way on my end with doing this podcast. It just keeps my curiosity alive. I keep learning. I mean, I've learned more in the last 3.5 years with this podcast that I take to my students, and I catch myself, as I'm teaching exercise science to a lot of athletes and people that want to go into sports training, some want to go into physical therapy, but teaching them from really a longevity, health span perspective. And I catch myself, because as I do this podcast, we tend to say, as I just asked you, what are you doing personally to age well? So I find myself in my lectures, and when I go to say age well, I have to put that little pause in there and give my catchphrase. But I'm the same way. I love the New York Times games in the morning. I have a couple students from about a year ago that got me hooked on that, to where I have to do Wordle every day and then do Sudoku and, keeping my score of how many days now I think I've only missed like maybe 3 or 4 Wordle puzzles in that year's time. So,
by the way, I had a big moment 2 days ago. My first Wordle, I got it on one guess.
I'm jealous. I haven't gotten that yet.
It was like just typed in a word and it went, congratulations. And the Wordle guy said, or Wordle bot said, go buy a lottery ticket. Today's your day.
Yeah, I think I'd rather spend my really good luck on a lottery ticket than getting Wordle in one. But
It's,
I could do a lot more with, winning a few $1 million than I can with saying, yeah, I got it in one. But I use
one
the
thing
same words.
I wanted to ask you one thing. I wanted to follow up if I can, and I know it's your podcast, but please indulge me for a second. You talked about language, um, aging, elderly, seniors. What words do you find you're comfortable with, and the people you're talking with are comfortable with to describe that process?
We did an episode on that because my wife brought to my point how kind of saying senior all the time and elderly, how offensive it is to people. It's challenging because, especially being a teacher, and we talk about, you know, older adults and things like that. It's like, so what's an older adult to you all? And then they kind of hesitate a little bit because they know I'm going to be 62 the end of this month, and they they really don't know what to say because you just go by a number. It's kind of sometimes confusing. So I tend to prefer just kind of like older adult. I don't like senior citizen. I don't like elderly because, again, elderly to me implies frailty. And
Right.
when we refer to somebody just based on looking at the number of when, the date that they were born and call them elderly, I think there's people that are in their 40s that are far older than me. And, there are probably people in their 80s that are younger than me. And
I was
so
just going to
I
say I
just
would.
kind of, I haven't really settled on the terminology yet. I just kind of, it's like, this is the age I'm at, and, you can quantify it as, I mean, middle age, even that sounds, really negative. When we talk about somebody being middle age, in our generation, that would be somebody probably in their 50s, and now I'm 62. I feel like, well, that should be middle age because my goal was to hit 120.
Yeah, but middle
So,
age, you're only halfway done. It should be kind of positive, you'd think.
yeah. I mean, at middle age, that's where that's where the freedom hits, right? You hopefully are financially stable. You are retired, maybe. I don't know that I'm going to retire anytime soon. I'm sure you're not planning on retiring anytime soon. I
Hopefully
mean,
not.
you keep going, and I think that's kind of the benefit of being in the fields like we're in, where we can continue as long as we want. I mean, I'm going to teach as long as I'm capable and competent, and I have no desire to retire because what am I going to do in retirement? Do this podcast. Yeah. So if this starts really making a lot of money for me, yeah, I'll go full time with this and I'll keep doing it until, time cease to exist, or I'm so wealthy that I don't need to work. I can just travel. But yeah, I don't know that I really have a great term for that. And, sometimes it depends on the population you're dealing with. But I think when you use any terminology, it has to be defined in the context of how you're using it. So from a researcher, you start looking at, young, you break things into age groups. And even that, it's like, at what point do you decide to call a population elderly or older adult? An older adult can be a college age kid, when it's relative to
Yeah.
a high school age kid or, preschooler. And so I don't know. I just like to kind of label people based on their age. So, you could say 80-year-olds or, 90-year-olds rather than older adults, because I'm sure you probably encountered in the documentary, there are people who are much older than us that are still very alert, very spry, very fit, and they're in great shape. And then there's people much younger that are really struggling health wise. And so,
I think there's also one of the things that I'm in doing this for a while, working in the aging field, not to, if somebody isn't spry or physically able, if someone's in a wheelchair or somebody has certain physical disabilities, that doesn't mean their mental and emotional abilities are handicapped as well.
right.
And I think that one of the pieces of ageism that we have in our society is we'll look at somebody who is possibly older and frail, but that doesn't mean that they don't have something really significant to offer. And I think that that's one of the things that I kind of noticed myself of appreciating people more, regardless of, they may look old and frail, but they have a lot to offer.
Yeah. We just at my church a couple Sundays ago, they had a birthday party for anybody that was 90 and over. They do it every year. And there was one woman there that was 100. And I would not have guessed her to be 100. She's obviously in her 90s. And some of the 90-year-olds, it's like, no, there's no way you're 90.
Yeah.
But she's 100 years old. And she was telling me that her father lived to be 106.
Okay.
And he, at 93, went to the North Pole. And he had written his memoir. He'd done all kind of stuff in his life. He wrote a memoir at 87 and had to write a second edition to it, or volume 2, because he did so much after 90 or 87 that he needed to write another book. And that, to me, is just fantastic aging.
Yes, that's the definition of it.
Yeah. But you're right. I mean, we look at people that outside of their own control are maybe on the outside not looking as healthy and spry and to be aging well, but there's so much else going on inside. There's so much other experience and stuff that they still bring to the table that we tend to ignore just because of the outside appearance. And I think we see that in the young as well. I mean, even just if you're dealing with, I don't like the term disabilities as much because I think of it more as limitations, because we all have our limitations. And just because we can't do what is considered to be the norm doesn't mean that there's not other stuff going on. And you interact with somebody who maybe has a severe, something like maybe severe cerebral palsy. You go up to them and they can't communicate well, but their mind is still super, super sharp. It just takes them a little bit longer to get that information out. Sometimes we're just not patient enough to let people, shine through their outside appearance.
I recall talking with a professor who has dealt with a disability all his life, and we were talking about that. I was interviewing him, and he said, one way to think about it is you were just temporarily able to, that eventually, the body does break down, as much as you try to take care of yourself. And so he's going, you're just temporarily able at this time. And that when a disability might hit you, it could be devastating. I've grown up with it. I'm going to be prepared for it. And I thought, wow. Again, that whole idea of looking at things from a completely different angle, I find so fascinating.
So with your decades of experience in this field, what gives you hope about the future of aging in America?
I think there's people out there who are really smart and kind and considerate. And I'm doing video and films. I've interviewed a bunch of them, and I find that very encouraging. I think that there is people who are so completely dedicated to this endeavor of making the world better for older adults. Will it happen as quickly as I hope? Probably not, but I do believe it will happen.
So with your experience with Dr. Butler and doing the documentaries and the work you've done over these many years, how has your views of aging changed over the years, especially through the lens of this film?
I think I kind of grew up with the notion of aging almost equals decline. And I really realized in all my work in aging, over the last several years, quite a few years, decades even, making films about it and videos. But that's just a myth and a misconception that I firmly had. It's young is good, old is bad. And I've learned how wrong I was to make that assumption. And that's not just me aging. That's just me getting wiser.
Right. Which is aging. Aging is wisdom.
Yes.
Yeah. So is there anything we missed talking about with the documentary that you want to make sure that the viewers and listeners hear?
No, I think you did a really good job, and I think we covered everything. And again, I just, the only thing we didn't talk about is that one of the things we really want to do with this documentary is to really honor Dr. Butler's legacy. He is a major figure in American social movements. I mean, he had done so much. He was such a pioneer, and he isn't recognized quite as much as some other pioneers in other fields or other areas. And one of the things we really want to do is to make sure, help spread the word that there once upon that there was this guy, and he really had a vision for what it meant, and that there's generations of people working in gerontology and aging and geriatrics that he gave birth to that. And it was a pleasure to kind of help amplify his message.
Yeah, you asked me earlier about words that I would use. One word that gets used a lot, and you just kind of used it, that kind of bothers me a bit, is the use of geriatrics. as we talk about aging, because, we tend to associate geriatrics. Well, geriatrics is basically by definition, the, declining, physical capabilities and health and all those types of things, and this, the study of that. And so we tend to think of geriatric population, just the older population, but the geriatric population is that fourth age group, and I think we need, as we've been talking about, to kind of change our mindset on what it means to be aging and understand that, the older population has many, many things that they bring to the table that we need to recognize. And that just because we're getting older doesn't mean that we're declining, yes, but the rate of decline doesn't have to be as pronounced as it often is.
Yeah.
And we need to do what we can to slow that whole process.
Let me offer a slightly different way of thinking about that. And that is, nobody would say a negative thing about pediatrics.
True.
And geriatric, pediatrics is just a specialty of medicine that helps younger people, very young people. Geriatrics is just a specialty of medicine that helps older people. And yet there's a negative connotation to it. But nobody would say, oh, I'm a pediatrician, and have someone say, I'm sorry, oh, that must be depressing dealing with kids all day long. I think that's kind of one of those little inherent ageist things that we kind of deal with in our society.
Yeah, I guess that's probably kind of how it's evolved too. I mean, maybe it has devolved from that. Maybe it originally, when they talked geriatrics, it was the more negative connotation. But you're right. I think we need to put a positive twist on the study of geriatrics and look at it as aging well.
It's cardiology. It's just it's a different specialty of medicine that focuses on things that happen later in life. And you're right. We do put a kind of a negative spin on that, but we should.
It just kind of occurred to me that, the pediatrician is really one of the few that are, the few areas of medicine that are considered the positive area. When you're working with a pediatrician, you're getting kids healthy, you're working with, young people. But then you look at cardiologists, they're working with people with diseased hearts. Urologists are working with people with diseased kidneys, or, the list goes on. And it's always a negative. And I think that's the problem in our healthcare system, is we're focused on treating the symptoms as opposed to, preventative care. And so gerontologists, and most of the ones I know, are really much more focused on successful aging as opposed to dealing with the problems that come with aging. And so I think that's the mindset that hopefully your documentary is going to help to change a little bit.
That would be great. That would be really wonderful.
Well, I really appreciate the work that you're doing, and it certainly supports the work that I'm trying to do here. And hopefully my work supports your work, and
Absolutely.
Maybe together we can help to get the American population to age well. Thank you for listening. I hope you benefited from today's podcast. And until next time, keep aging well.